to share is I'm going to, even within the backdrop of these 4 questions that came in ahead of time, um, that this is, I'm going to try to broaden those questions so that a lot of the information is going to be applicable to just everyone's better health, as well as targeted, and try to give some suggestions and recommendations. But again, it's not to be interpreted as direct, medical advice. So you still have to work with your medical professional on any change in diet and approach or supplementation with your self or your child. So I guess I just want to, it's okay, anyone who submitted questions, I don't necessarily have to name a child if the name was put in, or I can just read them as it is if it's okay to just go forward with that. So everyone who submitted is good within this group for me to just read them as is, I guess. Or you've got them. All right, so let's start with the very first one, which was, oh, good, you already did it. You abbreviated the name. Okay, perfect. So, I'll just read it quickly so as everyone else can, that by the time this little one this little one is 8 at this point, okay, strictly on a formula. And since last year, he had a bad virus that ended up with an awful case of pancreatitis, which for everyone, I'm sure you're aware, the pancreas is the hub for really digestion, provides insulin, it provides all the pancreatic enzymes necessary to break down fats, proteins, and carbohydrates. So, so inflammation of the pancreas, that's going to kind of seize the ability of the body to do all of that, to break down and assimilate food properly, because otherwise, when it's not properly digested, it's just going to be in the gut, and the gut bacteria are going to work on chomping on it to break it down, and they're going to feed on it literally, and it creates all sorts of fermentation and bloat and horrendous other gastrointestinal issues and inflammation and malabsorption. So awful case of pancreatitis and hospitalized for a week. And I would venture to guess may or may not have had antibiotics during that time, because sometimes even if it's a virus, that is generally the culprit when it comes to pancreatitis. Even in terms of triggering type 1 diabetes, there's thoughts between both early milk protein issues, even some early celiac issues, but then most often a virus, right? So it's maybe some genetic predispositions and environmental circumstances, and then a bug of some sort. But sometimes antibiotics are given to prevent secondary infections because there's so much compromise going on in the system at that point. So his ability to tolerate food kept decreasing, understandably, and decreasing to the point now, even though I guess the pancreatitis, of course, is recovered, but now we're left with all this, damage in the gut. So can only tolerate formula. The Neocate Splash plain, not even the flavored, right? Because the artificial flavors and compounds that they put in there as flavoring agents also, require sometimes a certain amount of breakdown and certainly even a certain amount of detoxification. So that all puts a stress on the gut as well. So Neocate, for those who aren't familiar, is what's called an elemental formula, meaning that the protein is completely broken down into just amino acids. So you have whole proteins and then peptides and then amino acids. So peptides are just those chunks, so kind of like pre-digested, right? But so you have, even say, let's talk about infant formulas, right? There could be regular Similac, like whole milk, and then there could be something like Progestamil or Alimentum, which are like more peptide formulas where it's pre-digested. And then there's elemental formulas. Neocate makes an infant amino acid-based elemental formula, just the elements. And also Elecare is another one. So the Neocate Splash, like Neocate Junior, is provided for kids over the age of 1, generally I think to age 13, to my recollection, for complete nutrition. So there are some carbohydrates in it that are a little more broken down, but it's not, the elemental portion really refers to the proteins, not so much the fats or the carbohydrates in it. So you guys have seen a slew of people to get some assistance. I'm not sure what diagnostic tests may have been done, but we'll talk about that as well. And you certainly want to be able to advance to something more than just formula, and more than anything to prevent all this GI distress, because, you know, we've got to get absorption going, and we've got to have quality of life and wellness and function. I mean, when your tummy hurts, it's really hard to do anything else in the course of a day. So the little extra background there, probably easier for me to read it on the screen than from my printout. Breast milk primarily, and then rice milk, and a blend of, you know, certainly what sounds like very wholesome foods. But even there wasn't the best tolerance, right? And then you bring up the question as to whether or not even fructose intolerance may be an issue. Okay, so I'll just, again, for the sake of trying to be as concise as possible, you know, early history is also what comes to mind, right? Because there's also suggestion that the gut function for this little one was really never optimal. So there may have been early history of either, you know, antibiotics or something that might have sort of blown out the original footprint of the microbiome, making the gut, you know, that much more challenged right out of the gate. That sort of maybe set in motion what could have created the vulnerabilities even toward the pancreatitis. I'm speculating, but this is just so that everyone else could think about what might be applicable in their own circumstances. And by the way, this applies, what I'm about to describe, and even what's noted here, this is not necessarily just, you know, anything that is owned by 8P individuals. It's really unfortunate when it's layered on an 8P diagnosis, but this is why I want to just discuss all of this in even general terms, so that everyone has an understanding for them, you know, themselves and other family members in terms of just gut health. And certainly having an 8P diagnosis can make one more vulnerable, as we discussed early on, just between various body demands, oxidative stress, bowel motility issues that are related to tone. So, you know, there's significance there. So there, you know, it's predisposing, but it doesn't have to be as a result of 8P. So that's why I just want to share, so you can think about this maybe for, you know, even yourselves, if you have a long history of gut issues. So it's possible between early antibiotics and even constipation that there could be a dysbiosis, meaning an imbalance in gut bacteria, right? So we have our microbiome. So there's good bacteria in the microbiome, most certainly. And then there's what's considered like non-beneficial stuff that has the potential, if it overgrows, to be bad, but in and of itself isn't so bad. It's just there enough to help promote that good gut bacteria microbiome component into producing proper immune response, right? It's how, you know, we hear about, like, oh, well, a little bit of dirt or a little bit of germs, right? But that's so that the gut can develop that proper immunity and determine friend from foe. So sometimes with the antibiotics and even, you know, birth, even the C-section deliveries, everything that interrupts that good bacterial footprint in the beginning can set the stage where you get more of a dysbiosis or an imbalance between the good and the bad bacteria, like the non-beneficial. So I can say good and bad, but I don't mean bad in terms of pathogenic bacteria, like disease causing, like salmonella or giardia or listeria. So just to kind of understand bacterial imbalance within the gut. But you can get an overgrowth of non-beneficial bacteria. And you can get an overgrowth of yeast and other fungal organisms as well, especially in response to carbohydrates and antibiotic exposure. So all this completely throws off the gut function. And what it can do is it can really reduce some of the enzyme activity that's functioning at the brush border of the gut. So we have the pancreas releasing enzymes to help break down proteins, fats, and carbohydrates. And then we have the final stages of digestion in the brush border of the gut, right at the in the lumen. So just before everything's trying to get assimilated, crossing over into the bloodstream as a source of energy or nutrition. So so the thing is, all of that, that gets disrupted on that brush border level, and then it puts stress on the rest of the gut to do more work, do a little more heavy lifting. And then if there's constipation, there can even be a backup of colon bacteria, which is different. The composition is different than the bacteria that's reside in the small intestine. So when you get that backup, that's that then is all of it could be diagnosed as SIBO, as a lot of people are familiar with the terminology for small intestinal bacterial overgrowth. That's what the acronym is for. And that's because you're getting this overgrowth in the small intestine of bacteria, maybe from the scenario I described, or maybe because that ileocecal valve, the top of the large intestine, and the bottom of the small intestine, when you're so constipated, it basically reflux up into the small intestine. You're getting colon bacteria that can then overgrow, because it's like, oh wow, we're used to being down here with all the waste, but up here there's all this great stuff to eat and munch on and grow and and proliferate. So that small intestinal bacterial overgrowth, or SIBO, can also just create all of, and then more gas is produced, and then more reflux, and just more stress on the gut in general. So sometimes you can do comprehensive diagnostic stool analysis to really determine what bacteria are down there. And there are a number of different companies that do that now, which is different than just maybe a stool analysis that is done by just your general GP or gastroenterologist, because they're maybe examining for bacteria, those pathogenic bacteria, right? So they're trying to just rule out that there are the really bad bugs that may be there. That's different than determining what is actually there. And in terms of that balance of, how many good species and how many commensal or non-beneficial species, and is the gut populated with the right stuff? So that's sometimes something to consider as well in terms of digging in, just to determine the status. And again, it's not just about then throwing more good bugs in, because they still have to land somewhere favorable for them instead of just going to war with bad stuff that's down there. So, but it's information, which would be the first step. So the other thing too, so I just want to see, I've made some notes. So I talked about the brush border enzymes. So the other things to consider, would be, even as a result of the pancreatitis, and maybe even what led to it, is there some type of pancreatic insufficiency? Like, is the pancreas, does it have the ability to provide really good enzymes, right? So we know in cases of conditions like with cystic fibrosis, where the pancreas is also impacted, that exogenous or outside enzymes have to be given therapeutically. So there are basically like prescription ones, but then there are certainly over-the-counter ones, and they usually involve certain proteases to help break down the proteins, and carbohydratases, primarily amylase, and then lipases, a fat, to help break down fat. Because you have the bile that helps with the sort of pre-digestion of the fat, but then the lipase to ultimately really break it down. But if the pancreas isn't able to get those enzymes out in response to the presence of food, then any food is going to create a lot of gastric distress, because it's just like staying as whole food going down into the gut. And then how is that going to be digested? So, So, I mean, there are tests to rule all that out, but if you don't necessarily want to get particularly invasive, personally, I don't think that select digestive enzymes, and I'm talking about the pancreatic digestive enzymes. I'm not talking about increasing stomach acid, which could be irritating. I'm not talking about, supplements that could increase hydrochloric acid in any way, because that can be an irritant. And I'm not talking about like plant enzymes like bromelain or papain, which can also be irritants. I'm talking about actual lipase, amylase, and various proteases that will be activated in the small intestine to do what's supposed to be done. So, as I said, it's this exocrine pancreatic insufficiency, or EPI. So it could, under the doctor's care, enzymes could be added, even currently with the neocate, just to see if that even helps improve tolerance to neocate. So that's one thing. Looking at the fructose malabsorption, other things came to mind with that. And I didn't look back, but I don't think I'd have to look back if there's fructose in the neocate formula. But whether there is or there isn't, you could certainly check for that. But and there is a genetic fructose malabsorption, and then sometimes it comes as a result of just all this disarray that's gone on in the gut from any one of the scenarios that I suggested. Similarly, like lactose intolerance, right? Because lactase is an enzyme that's eliminated very quickly. So when there's any kind of bowel disruption, I think anybody who's ever had a gastrointestinal virus and a 24-hour bug, let's say, and then you think you're over it and you drink a glass of milk and then you've got diarrhea again. And that's just because the lactase hasn't had time to come back to help break down the lactose in milk. But so sometimes you can get those going on. Also, what there is that I made a note of is also sucrase isomaltase deficiency. And so what that refers to, remember how I discussed like the proteins, being whole proteins and then peptides and then amino acids. So when it comes to carbohydrates, you've got complex carbohydrates, and then they go down into like chunks like polysaccharides, and then it goes down to disaccharides, and some sugars are a disaccharide like sucrose or table sugar. And then it goes down to monosaccharide, and it's that monosaccharide like glucose that can go, directly into the bloodstream. It doesn't require any digestive enzyme. So you'd want a formulation that is primarily a monosaccharide in the carbohydrate source. So you can have the proteins already being in the peptide or in the elemental amino acid form, but you might want to consider making sure that the carbohydrates are all in a monosaccharide or primarily a monosaccharide form, delivery form. So that's something else to think of. All of these sucrase isomaltase deficiencies, lactase deficiencies, fructose intolerance, because fructose intolerance, like fructans, suggests more about the inability to absorb and then the fermentation of that sugar in the gut. And then if it's combined with yeast, again, just like making beer or wine, right? You add yeast to a carbohydrate, you add grape mash and yeast to get it percolating. So if anybody's done any home brewery of anything, you know how it works. It works that way in your gut as well. So it's a combination of a lot of factors. So sometimes you can do the dive to determine, or you can just try to change, what's going in, or provide some enzyme support and see if there's improvement. Either way, whether you're getting a concrete diagnosis or you're getting a differential diagnosis. But to check for all these carbohydrate problems, most of the time it involves taking in that carbohydrate, and then after a certain amount of time doing a breath test to determine whether or not you're creating a lot of different gases as a result, which would mean the bacteria are working on it, which would mean you have an enzyme deficiency or insufficiency to break down those carbohydrates. So those tests are tough to administer. So, that's why I'm saying that maybe the goal would be to just sort of provide best benefits to the gut for even for a period of time, providing the enzyme support, making sure that the formula matches up in terms of the carbohydrate as well as the protein source.
Carrie, is there specific labs or blood work that you would suggest screening for? Because a regular CBC isn't really going to give us much information.
Yeah, for sure. A regular CBC isn't going to give us much information. And there are, so listen, the testing that I'm describing, some of that can certainly even be done by, let's say, a conventional lab with your pediatric gastroenterologist. But the comprehensive diagnostic stool analysis, that type of thing, to really see what the current state of bacteria, the microbiome is, that's generally not, that might be more like what would be called like an alternative lab, because it's information that's considered more from a research end, because it isn't always associated with a treatment. Like standards of practice within conventional medicine, you're doing a test to come up with a firm diagnosis in order to provide a treatment. And a treatment generally involves some type of medical intervention, a prescription of some sort of pharmaceutical, a surgical intervention, or a wait and watch where procedures will continue to be done, episodically. So the alternative lab, something like there's GI Maps, there's Great Plains Labs. Again, these are in the US. But I think they're pretty much, they're around the world these days. I just don't know if they equate with the same names. Some people are doing the biome test. And it really analyzes the stool to tell you what's there. So as opposed to ruling out, like I said, just bad bacteria. But as far as even checking from a conventional standpoint, say beyond a CBC, right? So the complete blood count means that's looking at red blood cells, white blood cells, and a differential or a breakdown of those white blood cells and platelets. So if someone's anemic, it may or may not show up. You could be borderline in that hematocrit and hemoglobin, but then you might want to ask for a ferritin level, right? Because ferritin represents stored iron. And if there's malabsorption, you're probably not going to be absorbing iron very well. So, if that you're on a CBC, the hematocrit and hemoglobin might look decent enough. But then when you look at the ferritin level, and there's no stored iron, that eventually that's just going to get further depleted, and then the anemia will kick in, but then that interferes with growth and immunity, so we do want to close the gaps on as many of the nutritional parameters as possible. But yes, to your point, they would have to be determined. So checking homocysteine level, which is a marker not only for inflammation, but also B vitamin absorption, right? So you want to look at homocysteine level or B12 level in the plasma. Doesn't always tell us what's going on in the cell, but it's worth taking a peek at along with the homocysteine level. The ferritin, as I mentioned, vitamin D, even though that can be given supplementally. And if there's sun exposure, you're going to make it through your skin, not necessarily worry about absorbing it through your gut. But even in terms of gut health and integrity, nutrients like zinc, so like measuring a red blood cell zinc and a red blood cell magnesium, is important also. Serum calcium is not going to give you status of your your calcium, because the body will take calcium from the bones to keep it in the normal in the blood. So, but certainly there are, and then there are tests like the Nutritional. I think that's a Genova test off the top of my head. That does look at, a deeper dive, but you can pretty much request anything. I mean, blood levels of vitamins B1 and B2, and vitamin A levels. I mean, all of those could be asked for and can be ordered individually when there's concern about nutrient insufficiency or deficiency. um, you know, so, but those are just some of my thoughts in terms of the labs. Okay, so that I think, uh, I'm not even looking at the time because I'm just looking at the screen and everybody's faces in the little gallery view up over here. So, and then my notes, but I don't know how much time that took up, but I guess I should maybe move on to the next one, and hopefully that was enough advice to give some insight as to areas to pursue. But I would think that's some digestive support from an enzyme standpoint.
Could we just take a pause and see if there's anybody that has questions
Oh yeah,
so
questions or
far?
comments on everything I just said.
Jerry, this is Will Norris. I have a quick question. You did mention a little bit when you were talking about the connection between the small intestine and the overgrowth. Are you going to, at some point today, be able to tell us a little bit more about your thoughts of the sort of biochemical or biomolecular connection to the neurodevelopmental side of some of that overpopulation and that overgrowth?
Not necessarily, but I could right now. And I'm thinking that in one of the talks that was touched on, were you on all of them? You were?
Not on all of them, but I think it was on one where you did touch on it a little bit. But I just wanted
Yeah,
to hear
because
your
we
thoughts
did
on that.
one really on sort of the whole gut-brain connection, and I'm pretty sure these are subjects that I speak about a lot, but I'm pretty sure that it was touched on, but not a problem, certainly. But if you have an opportunity, maybe there'll be some additional information there to listen. But basically, when there is an overgrowth of, so these bacteria, not only do they create the various gaseous compounds, and when people are checked for SIBO through a breath test, right, you're looking for either like hydrogen gas or methane gas, because different bacteria produce different types of gases. But also, bacteria create organic acid compounds, and some of those organic acids have been shown in the literature to cross the blood-brain barrier and impact behavior. It's kind of, in a way, it's not unlike the sort of like a sugar coma, right? That kind of also comes from everything we just fed the bacteria and the fungal organisms, and that carbohydrates can induce some serotonin and states of like relaxation, and like the whole combination, it's definitely gonna put you out, whereas proteins will increase dopamine for alertness and attention. But it's the carbs, the bacteria really feed on, and the yeast really feed on carbohydrates, and that's why you get a lot of information on sort of like the keto side of things and the paleo side of things in terms of eliminating. And I'm not suggesting necessarily, I'm just talking about the genesis of those diets from a potential medical treatment standpoint, and even how states of ketosis can help optimize mitochondrial function. So for some of the mitochondrial complex disorders and hence even seizure disorders, the ketogenic diet has been shown to be beneficial. Now, how much that also is related to the elimination of certain organic acids, because now you're starving off the bacteria, So there's a lot in the literature, and it's all pretty complex. So that's why sometimes, that, as I've said before, you just look at everything that's going in and then the symptoms that are coming out on the other side, because again, everything can look like it's very healthy going in, but it just may not be the right fit for what's going on bacterially and biologically in terms of metabolism and what's really going to work. So sometimes just to shift the outcomes, you have to change up the diet component, if that's enough of information to give.
Sure. Yeah, and just one quick follow-up. We've had
Sure.
episodes where there'll be like big yeast overgrowth, and then something that was kind of interesting for me to hear is the breath detection, because there's been times in the mornings when I'll go get him, and his breath smells very unique. It's like exactly the same way that it smells like when you open a can of tuna, which is a very unique, particular smell. And he never eats tuna, and there's no tuna involved in any of this. But it's almost as though the exact same thing. Does that ring a bell for you at all? Is there something that's sort of like, oh, that might be this, or because that's been a big puzzle for me too.
I mean, not specific to tuna per se. I mean, that almost suggests, I mean, anything, literally anything fishy would be like, would suggest, and pardon the use of the word, like putrefaction, but it would suggest that there's some kind of, I think, fermentation or something going on, that there is some type of dysbiosis or bacterial imbalance going on. I mean, that's emanating from the gut, is, provided that the teeth and oral cavity is okay, then that's something that would be coming up from the gut, especially overnight, right? So,
And I was, Jerry, I was gonna ask, I don't think, Karina doesn't eat any fish whatsoever on certain days, but once a month or every 4 or 5 weeks, it seems like she also has this very smelly morning breath, and she's a little greenish looking. And I think Will was just alluding to tuna as like kind of to indicate what the odor was, but again, nothing to do with fish. I mean, she actually woke up this morning with it, so it's completely appropriate that Will reminded me about this smell. And I wonder.
Now, is it related to when the last bowel movement was by any chance? Like, do you notice it more if we're going on day 2 or 3 without pooping? Is it literally from like this backup situation?
For us, it could be. I don't know pattern, but coincidentally, because this just happened, she had a bowel and she woke up with smelly breath.
And our guy is very, very regular. So it's typical that he would wake up in the morning and have a bowel movement. But that's not unusual. It's almost every single day he'll do that. Until the last 2 or 3 months when he's finally gotten potty trained, in which case he's been able to hold it for a little while longer. The only thing I would say that this coincides with, not necessarily bowel movements at that sort of daily level, but the big yeast overgrowth in the stool. So there's times when you could change a diaper and you would smell, it smells like fresh baked bread. I mean, it's very potent, and you know exactly the smell is yeast. And so we did have the Great Plains do that full stool
And
panel.
what you get?
And we definitely had a huge yeast overgrowth. And so they recommended nystatin to kind of knock it down, and then biocidin to kind of maintain it. And it did go away, but it's episodic. It'll happen.
Well, it's going to be episodic because those organisms are always living down there. And so if there happens to be a day or 2 where his carb intake is higher, without reintroducing nystatin and biocidin with it, you're just going to get that kick up. I mean, it's a lot to stay on top of. It's not like just you treat it and then it's gone forever and you're good. So that's why you hear biofilm protocols where you really work to kind of dig down a little deeper, because all these organisms, and that would be something I suggest that if you're going to consider that, you do that with a good, a functional provider.
Yeah, we've had a problem finding a reliable functional medicine provider. The ones that we've found haven't been impressive to my taste.
I'm sorry. And the reason I only say that is because biofilm protocols involve giving certain enzymes that break down that mucousy, like the biofilm in your mouth from your dental bacteria, right? Like that's what makes plaque, and that's what makes cavity, and it feeds on sugar, right? And then you brush your teeth and you bust away all that all that bacteria and they're squeaky clean. And then an hour later, if you don't eat anything, even the remaining bacteria are like, wow, we better protect ourselves. And and then they make that shield or that biofilm, and so then suddenly you go from squeaky clean to a little slick, right? And then that's the way it goes, and then it goes all the way down our gut that way. So sometimes it's a matter of very specific enzymes. Again, we can't bulldoze the gut, and we can't do anything that could potentially irritate the stomach lining. We're talking about getting into the small intestine. So very specific types of enzymes in conjunction, say, with biocidin, right? Because otherwise you're just always getting rid of that top layer, right? You're not penetrating through the biofilm. That's why we have to go for dental scrapings and cleanings, right? Because you got to dig in to get it out. It's not enough to just brush all the time. So it's a similar analogy. So that's, and at the very least, anytime he's having a carb meal, because nystatin stays in the gut, it doesn't get absorbed systemically. It's not like a diflucan or one of the other stronger antifungals that get processed through the liver. So it's somewhat benign, essentially. And you can do that with some biocidin to combat this situation.
The one thing we've noticed is that the behavior tends to become more, there's more behavioral outburst issues. And then maybe 1 or 2 days later, we'll sort of smell the yeast in the poop when his body has kind of processed it through. Does that make sense too?
Absolutely.
Is there any leading indicator of those behavioral outbursts so we may be able to try to get out in front of these kinds of episodes with?
Well, I think just keeping the carbs down, and also and treating it with the nystatin and as I said. So the other thing along those lines too is, even though he's having regular bowel movements, maybe the food combining could be a consideration as well. And that's where so fruit, for example, provided there's not a fructose intolerance, should be given before a meal or on an empty stomach. So this way, since fructose is a monosaccharide, it can just be absorbed very quickly, as opposed to being given with a meal or on top of a meal, where it's more likely to add to the fermentation process, which will then also feed the yeast situation. And also, if you're going to give like a carbohydrates, to maybe give the carbohydrates with vegetables, because those will digest faster. When you give the starch with an animal protein, it slows down the digestion. So even though he's pooping regularly, it's still going to go through the gut a little more slowly. And the slower it goes, the more ample time there is for bacteria and yeast to feed on the carbohydrates. So to kind of get ahead of it, you might change up the way he eats. So instead of, so even if he's on, say, a gluten-free diet to keep gut load down, you don't want the gluten-free tapioca bun with the burger necessarily. You might have to have a veggie burger with that bun if he likes that kind of thing and can eat that kind of thing. And then just have the meat portion with some vegetables. And give the fruits, like I said before, when the stomach's empty, or in between when the stomach's empty. And then anytime there's a carbohydrate being given, it wouldn't hurt to make sure that nystatin is going in a couple of times a day, or alternate, like nystatin a couple of times a day on even days and biocidin on the odd days. So because these bugs habituate, right? So it's not like, oh, it's nystatin, biocidin coming in again, but if it's like, whoa, nystatin today, biocidin, it's coming tomorrow. So anyway, I'm serious. I'm kind of getting goofy, but you know what I'm saying. These are all various techniques that can really be effective in staying ahead of the circumstances, and then just see how he does. Just check the outcomes, and then it can be tweaked from there. I know it seems so monotonous to like keep data or keep a little calendar, but it is good. It's important, and it's well worth it given, how the weeks and months and years click by, because sometimes, we're just so in the weeds that it's like, oh yeah, we tried that, I think we tried it for a week, or we tried it for 3 days, or you got to really, stick with some of this stuff for a good clinical trial, so to speak. And then instead of abandoning one and then nothing, or abandoning and starting something all new, maybe try adding on these different techniques, and develop his own personal protocol.
So I have a question on that.
Sure.
My son is pretty similar with the high yeast. We've been on a pretty strict protocol for about a year, and I've just recently taken him off the nystatin, which he was on for a good 9 months to a year. But we've been giving biocidin, 1 pill with every meal.
How much does he weigh?
Right now he's about 110.
Okay. All right.
Would you suggest, I've just recently stopped the nystatin, just to kind of trial it out and see how he would do it without it. And it's been fine. Would you suggest I alternate, like you said, the biocidin and?
Possibly, for sure, because that's a hefty dose of biocidin, especially for any kind of long-term use. And the thing is that you're also reminding me that the biocidin should, of course, be separated from any probiotic that's being given, because you want to kind of do the killing off, and then you want to do the repopulating, right? So you can almost think about the biocidin as more of a natural, so to speak, antibiotic. So, so you want to like work on, but see, the thing is the goal, of course, is then through diet ultimately to prevent the constant reliance on these natural antimicrobials with all this regularity. And even though biocidin is a great formulation, it's, you might still want to change it up to maybe a straight olive leaf instead once in a while, or, the oil of oregano once in a while, or garlic once in a while. Because even though there's so much in biocidin, and Rachel, who developed it, the herbalist who developed it, there's a lot of ongoing research with it. Again, it's you don't want reliance, and you don't really want the gut to adapt to just constant reliance on that one.
Jerry, is a lysosomal spray for biocidin preferred for absorption?
I don't think so.
Okay.
I just think it's another mode of delivery, and I like the liposomal form when you're just trying to get into the bloodstream directly to, say, fight an infection, right? So if we're looking to get ahead of a cold or a flu or a bacterial infection or anything, and you just want it rapidly absorbed into the bloodstream. But we're talking about now where we want it to really land in the gut and kill off everything in the gut and take its time. Getting into the bloodstream has its benefits too, but not when we're trying to direct cleaning out the gut. Does that make sense? In terms of the liposomal versus, liposomal is almost like it's an alternative in a way to, say, IV.
Okay.
But here we're looking, I'm fine with like the capsule or the drops of the oral form, because we're looking to kind of contact the gut, not just saturate the bloodstream and the body that way. Does that make sense?
Yes, thank you. do we have time to go on to the next questions?
We do. I actually had, yeah, we do. I guess I'll be brief or try to be briefer. Maybe what I can do is go through with my thoughts and answers. I don't know if I even had a chance to look too much to the last couple. That there was one that came in this morning, but I'll do the best I can. And then maybe we can go to questions. I'm good to go a little longer today before my next appointment at 12:30 my time. So I know we usually try to do an hour, but so anyway, this question basically with regard, so what, all right. Are you aware of rapid weight gain with low calorie intake in any 8P kids? No, I'm actually not. But in speculating where it says and the cause and any research studies regarding obesity in this population, I when I saw this, I did do a quick PubMed search on it because I wasn't familiar with any particular case. And I only saw one study, and I can, it's actually opened on my computer, which is now open to the screen share with Bina and Katie. So I could put it either in the chat or send it later. But it was basically, to my recollection, just a case study where, again, the 8P was found secondarily to the obesity situation. The only thing I could speculate is we talked about, usually the metabolism is impacted by tone, right? And tone is impacted by mitochondrial function. All of this is just kind of, everything is connected. So generally speaking, low tone would result in easier weight deposition, even on a lower caloric intake. And high tone, which is, all the contraction and spasticity, is going to be burning a lot more calories constantly because the muscles are always engaged in an active state of energy utilization. So it's hard to keep up with the calories on that side. The body certainly, the body can certainly work very efficiently if for some reasons, so the lower the caloric intake sometimes, the more it wants to lower the metabolism to hold on to what it's getting. So, so that can happen, even outside of 8P. I think that because of 8P, I don't know if other genetic tests, so, if there's obesity in a low calorie situation, and depending on the age, like children with Prader-Willi syndrome or failure to thrive in infancy, and then as they get older, even like right out of their toddler years, the weight gain is exponential. And of course, they're also driven to want to eat a lot, but even outside of that, the weight goes on very easily, even on low calories. But that's a metabolic disorder. So I don't know if any other metabolic disorders were looked at. And you can even look at, things like leptin resistance and insulin resistance, that would be, hormonal contributors to efficiency in storing body fat and maintaining weight, even on lower calories. Again, it has to do with the composition of the macronutrients going in. So that was kind of all that came to mind when I saw that question. And I don't know how helpful that is, or whoever asked it, if you want to follow up with some questions as soon as I run through the other two, unless there's something very pressing that maybe I could respond to quickly in light of what I just said. No. Okay. All right. So then Right. So the dairy, okay. So I had some questions about this one also. So just to, again, everybody can kind of scan it to read it. I won't take that extra time to read it, but basically within dairy, we've got everything that I've talked about so far. So we've got proteins, and you've got primarily large molecular proteins, right? Casein and whey are the two main proteins in dairy. Then you have the sugar, which is lactose, or or milk or dairy sugar. And then you have milk fat or butter fat. And there can be issues with any one of those. I'm just gonna actually see how I can minimize so I can see the whole screen. So I have to look from the screen to, and then, all right, so all of you guys are all condensed now. Okay, let's see. I guess it's not the lactose part of it, but the protein, right? Because, but even when the protein digestion is extremely disruptive to the gut and the integrity of the gut, apropos of my earlier discussion, it can even help wipe out lactase activity, right? If the gut is all a bit disheveled, so to speak, from trying to break down these large molecular proteins, that it's causing all types of inflammation and bowel motility disruption, either diarrhea or constipation, then the lactase activity can also fail, because that's a very labile enzyme. And then you are going to have almost a secondary lactose problem. That's why sometimes people with gut issues, they'll get diagnosed with lactose intolerance. And then when they come to me, they're like, well, I was told it was lactose intolerance and I eliminated the lactose and I only get lactate milk, but my gut is still a mess. And that's because, yes, they have lactose intolerance, but that wasn't the cause. It was more of a result of other bigger gut issues going on. So, all right, are there any dairy foods that I could try starting him back on that are lower in the protein part? So the interesting part about this, what's written here, is that butter seems to be a bad one. So if I was going to suggest the lowest protein containing dairy product, it's butter. So, because butter is primarily the fat component. So the only thing less than butter, which would contain none of the protein, is basically clarified butter, which is ghee. And you could get organic ghee, in a jar. It's very popular in Indian and cooking and Southeast Asian cooking. But it's clarified butter. And or in the Northeast, we would use with lobster intake. But that is basically, when you melt it, that foamy part on the top that gets clarified away and you're left with just the butter fat. What you're clarifying away is the residual casein and whey, and if there's a little remnant of lactose attached to the whey component, the more liquidy part of the proteins, you're taking that away, and then you just got butter fat. But basically, butter itself is very low. So if that's making him uncomfortable, I certainly wouldn't want to push it in that regard. It's nonverbal, right? So yes, and okay. And also get constipated. And the yeast issues, which we've been talking about, and the yeast somewhat like paralyzing the gut, right? So then that contributes to the constipation in many instances. Although it's all very individualized and it depends on other factors in the diet. So you can be very yeast overloaded and be having regular bowel movements, even if you see them coated with yeast and white yeasty material sometimes, and that yeasty smell. Okay. What originates yeast? The yeast breakout, taking the dairy out, adding a lot, helped immensely. Okay, working with a functional medicine doc, also said to take gluten out. Okay, so the gluten component is also because of the fact that it's a large molecular protein. Gluten is also coming from, wheat, barley, spelt, and rye. And all of those are fermentable grains, right? They're also high in fructans. So again, when you already have yeast, that's like, again, the basis of beer, right? So, that's where I'd almost say the possibility of a little grain free over than just gluten free. And of course, yes, if you're going to do any grains, you want them to be organic, but there's just a lot of different mixed information in this scenario. So I guess I could suffice it to say, and then we can back up with any remaining time, I would really be looking at, again, the whole dysbiosis, the bacterial situation, as well as the fungal situation, and get on top of that and ahead of that. And I'm assuming that you've ruled out, perhaps through IgE blood allergy testing. The IgE is true allergy, not sensitivity, to rule out allergy to milk protein, wheat and gluten protein, maybe others like corn and soy and eggs. Those are the top 5 like common food allergens. And then you also could have nuts and fish. But right now, because you're focused on the dairy, I'm just thinking in terms of ruling out true allergy to it, right? Because it could be manifesting as a gut allergy too, or maybe even the skin component. I don't know the integrity of his skin. So, or even sinus and all of that. So IgE versus IgG, which is more reflective of a leaky gut scenario and food sensitivities. So then you could really kind of know what's happening there. Because if it's a true allergy, you may not ever really want to reintroduce it. And if it's a sensitivity, you'd only really want to reintroduce it once the gut was in good shape, which it sounds like there's still a lot more work to be done in terms of gut recovery. And you want to do that in a nice sequential fashion through how to address the diet, in combination with even a sequential approach with regard to the gut support, with maybe some of these supplements you're talking about, things to really rebuild the gut. It's all about taking away the load, rebuilding and healing and repleting, and then considering reintroduction. And again, that can take a full year as long as we're going in a nice sequential, orderly fashion. So there's some of that to consider. And then if it truly is, where it was a dairy sensitivity and you're making good headway with regard to considering tolerance and reintroduction, you would maybe want to consider not only small amounts, but certainly small amounts of maybe just the A2 dairy proteins. And those, I believe I also spoke about, and just for those who might not have heard it. So the difference being is the large Holstein cows, which are primarily producing in their milk supply a beta-1 casein protein, which is designed for a larger mammal. And it has a different amino acid sequence in it. It contains a histidine, where there would otherwise be a proline being a little bit more gut beneficial, histidine being the precursor to histamine and inflammation. And so smaller mammals like mother's milk and sheep and goat are primarily A2 protein, a little more digestible, as I said, and less inflammatory. And some larger mammals like certain cow species, like the Jersey and Guernsey cows, and they're smaller cows. Mammals, it's a large mammal. Camel milk, though, is also primarily A2 milk. There's a lot of science behind it. Dr. Richard Deeth, Deeth, ETH. Used to be at Northeastern University, and I'm sorry, I forget his current university affiliation, but a lot of publications on the metabolism of A2 milk and the cysteine component and the inflammation and the whole downward sequela in terms of impact on the immune system and detoxification capacity. So there's a lot to it. So the A2 milks are better tolerated if you're going to move back into a dairy scenario. So that would be my recommendation there. And then, wait, I think there was, oh yes, I'm sorry. There was one that came in this morning that was long, and honestly, I did not get a chance to read through all of it, but if we can go to this one, we could read it together, and because I think there's a lot of significance here that could be addressed that may be helpful to everyone else. And then
Jerry, there was one quick question in the chat asking if there was a healthy grain-free bread that you'd recommend.
well, I guess if there's no nut issue in terms of allergy or intolerance or oxalates, food is so complicated, then you can go with like a paleo bread, maybe like the Julian's as a name brand comes to mind. There are some others, basically you want clean for sure, but those are, the paleo breads are a nut and seed bread that are grain free. Okay, yes, here we are. So, okay, I know that when I took a quick peek at this, glance over this morning, I made 3 notes and I just wrote dairy, sugar, gluten. So those must have all lit up for me when I glanced over this, but I really only went through that first portion. So let's go through this together. So, okay, we got a good eater, and that's great, but the constipation, okay, and poor absorption. So that gets into everything we've already been talking about, and taking PEG or Miralax. This is Laxaday. It's all that polyethylene glycol component, okay, each morning to help with motility and getting, you know, certainly, to your point, a nice mixed diet variety. Oh, this is probably where I had read enough where I was feeling like, again, from attacks on the gut for all the reasons that I've already mentioned. Sorry, I just thought I would, okay, just looking at the time. So we're good. This should be good actually for a wrap up, because it seems like it covers so much of what we were talking about already. So that we've got the gluten and we've got the dairy and we've got the sugars, and all of which, and even the cranberry juice from the fructose component and the added fermentability component, right? And the sugars also. And I know suddenly, and I apologize, this is not to then suggest that we're just going to strip away everything, right? So I'm just, this is, now we're kind of using your question a little bit as a case study to just kind of almost pull it all together from a, based on everything that's discussed. So at this point now, maybe you've already gotten some insight based on everything that I said, answering some of the other questions, because there's a lot of, I think, based on what would in other circumstances be a very fine, excellent diet, especially if these are all coming from, you know, clean sources and organic grains where we're not getting, you know, residuals of herbicides and other potential chemical ingredients that can lead to gut disruption, right? And again, lots in the literature on that, and that actually add more of a load for detoxification. And when the liver has to work very hard to detox out chemical ingredients, and that requires a lot of nutrients, which means you need to be absorbing the nutrients, but we're kind of putting a toll on the gut already, and then we're not absorbing what we need to, and it just goes around until everything kind of starts to crash a little bit, and then we're not absorbing. And it's great she's absorbing enough to grow staturally. So that hasn't been impacted yet. Although I don't know if the rate of her height has slowed down, you know, where her height and weight growth chart is. So obviously she's fallen off the chart a bit in terms of weight gain. She isn't off the chart in terms of statural growth, but I don't know if she's come down lower in the percentiles. All right, so Pediasure. So Pediasure is dairy, sugar, and gluten. So we've got, again, the holy trio of gut insults, so to speak. And with full disclosure, I will say at this point, I have been asked to provide some key opinion leader consultative services to Kate Farms, but that aside, whether it be Kate Farms as a peptide-based formulation, plant-based, peptide-based, organic formulation, lower in sugar option, or even an protein elemental formulation like Neocate Junior or Neocate Splash. But the Neocate Junior, in this case, if we're looking to replace Pediasure, might be a better option. Or, as I said, the pediatric peptide 1.5 or 1.4 formulation, the peptide meaning pre-digested, of Kate Farms. I think could help take the load off of her gut, facilitate greater absorption, and right, so she loves it. She's getting enough of it supplementally. There's no weight gain because I think it's just contributing to more inflammation. Okay, so now our question is, what types of wholesome foods should she be eating to help her gain weight? The constipation. Okay, again, hopefully the fast food can cause severe tummy aches. Of course, it's not digestible. That's what makes it fast and able to hang out. It's basically, it's not well digestible. And so that is not an option, even though it's calorie dense. So it's not going to be good. It's only going to add to the inflammation. And you also feel that she has eosinophilic esophagitis, and you're going to have a scope done coming up. Okay, so the plot thickens. Now, of course, the 7 foods to avoid with EOE, and I haven't gone any further. So I had actually this morning just read the very first part, so I didn't even get to about the wholesome food and the fast food. So I just commented on that. Now kind of going sentence by sentence for this last paragraph, which I think also is so relevant to so many. So thank you for sharing your question. And I hope that some of the information I'm providing is really going to be helpful to her comfort and optimizing her overall growth and development. Because at 7 now, you know, any time is an important window of opportunity in terms of growth and development. But we'll be gearing up for another big growth spurt for her. So we want to make sure that we get her gut in good working order. And again, to create all that comfort, you know, for her. And even obviously, it sounds like despite the PEG every day, there's still the constipation. But of course, that could be because the sugars and the gluten and the dairy can all be contributing to more of that dysbiosis and that yeast overgrowth, which is all very paralyzing and then inflammatory. So there can be a lot of cleanup because they're all good options and clean options, alternatives at this point. But if we're thinking that there's also an EOE, so this is when white blood cells basically coat the esophagus and stomach and can go down into the small intestine as a way to almost block proteins from, proteins that are allergens to the body from penetrating and getting in. So the foods to avoid with EOE for gut healing include wheat, dairy, nuts, soy, fish, and I want to say corn and eggs. We'll double check. So very often, and without even looking further, very often part of the treatment besides the elimination diet, which can be challenging for some families, is to keep the acid down, right? So a proton pump inhibitor, which is the strongest form of acid control, is given. Now, because the acid tends to aggravate this situation. But you can't just treat that acid component because without really it kind of is just treating the symptom, right? And that's helpful at first for sure. But because you don't want the acid and you don't want all these white blood cells creating a real damage to the esophagus and the integrity of the stomach. So, but acid is there for a reason. It is there, of course, to help pre-digest the food before it gets into the small intestine, where the pancreas and the brush border enzymes are there for all that digestion, for assimilation, for use in the body. So when you don't get the pre-digestion, it puts a greater load on the small intestine. And then again, now we're into that whole bacteria having to work harder to chomp on all this food that hasn't been turned into a mash with acid in the stomach, etc. And then it's all very paralyzing. So reliance on these proton pump inhibitors secondarily cause a dysbiosis or bacterial imbalance over time, and can actually contribute to constipation issues and bloat. So that's why we always have to address the dietary aspect as well if we want true healing and the ability to wean off of a proton pump inhibitor over time. The other thing is the absence of the stomach acid inhibits the absorption of many vitamins and minerals that are acid dependent. Now, even though I don't know what's getting absorbed nutrient wise either, because clearly the macronutrients, the proteins, fats, and carbohydrates are not getting in because we're not getting any real weight deposition occurring. I don't know how many micronutrients are getting in, right? So the Pediasure's got some nutrients added. I don't know if she's on any additional multivitamins or minerals, but long-term use of PPIs, as everyone I think at this point is aware from all the television commercials, is associated with, hip fractures in older people because you just lose bone density because you can't absorb calcium. And regardless even of how much dairy is going in sometimes. And even some cognitive and neurological issues because of the impact of the absorption of B vitamins. So you do want to, when they're necessary, and very often they're necessary, you got to put out the fire when it's happening. You want to make sure that you're getting adequate supplementation to compensate. Now, I don't know what came first, right? Because the reflux and heartburn could have been the very first issue. Going back to the very beginning, I don't know what preceded. We're starting on this journey right now at age 7. So I don't know what preceded and what came first. So constipation could have come first. We sort of have this backup scenario, which leads to reflux. Then we're working on weight gain. So we're having foods that are primarily these large molecular proteins, which might be difficult to digest, which may lead to reflux. And we might be having some combination meals like lasagna and all that are slow movers through the gut, based on the food combining information that I was speaking to Will about earlier. So we have all of this sequence of events that now actually may have made the constipation worse and the reflux worse in an attempt to kind of heal those situations. I've read that Nexium could cause constipation. Yes, that was exactly what I was just talking about. However, she is better on it. Of course, she's better on because of the fire situation and possibly EOE. Let's see, she's staying on until we get the scope done next month. Now that's interesting because it's always been my understanding from the families I've worked with, based on their recommendations by their gastroenterologists, that they usually wean off, right? Because you don't want a big rebound hyperacidity. If you just stop at cold turkey, you'll just, it's like turning the faucet back on. You get all this acid and it's a misery. So you really have to maybe wean down to wean off. But very often they're advised to wean off of it and be off of it for some few weeks or whatever, for the scope, so that the real measure of the eosinophils could be determined. Unless, however, again, because I'm coming in the middle of this here, we've already been scoped once, esophagitis, gastritis, and some eosinophils were seen at the baseline endoscopy. Hence, put on Nexium, a PPI, for treatment. And now this scope is a repeat in September to see how well the Nexium alone is doing the job on the inflammation and the eosinophil production. Okay, my only question that may not be the scenario is that it says you guys feel she might have that. But if you were really going to be looking for that, I don't think it's going to be able to be diagnosed really when she's going in on Nexium. That's all. As long as you guys know that, you've talked to the gastroenterologist about that, because the PPI will mask whether or not EOE is there. Okay, hoping to get some answers. Are there foods to stay away from that make reflux? We stay away from fat. Well, right, because all those heavy fatty foods, right? Because fats empty from the stomach the slowest, so they're more likely to be refluxed up. And if it is a lot of citrus or carbonation, that's going to also contribute. However, I think based on everything I've already said to you so far, you can see where that's just sort of icing on top of the cake, and that there's a lot that we can do already to like clean up and clear out a bit. Hang on, I can't, oh, no, I could see the bottom of it. Nope, I can't every time. Okay, let me just find the last part. Okay, here we go. We hope, okay. So, okay, hoping, right, the scope can't be done soon enough. We usually eat about 2 hours before bedtime. If that last dinner meal is a large meal, then that's probably not even going to be enough time to help facilitate enough emptying. I don't know if the head of her bed is elevated, 30 degrees, generally maybe 45 to help. That's just mechanics. You know, maybe you want to consider trying to really eat like a funnel shaped or diamond shaped, because at least maybe, you know, digestion slows down as the day goes on. So, and then historically for many people, dinner is the largest meal and the most complete meal. And now it's going in a gut that's already challenged with digestion because of the Nexium and all the motility stuff. And then it's later in the day. So 2 hours might be fine if dinner is a light meal. Okay, she's having surgery to have an umbilical hernia repaired. Do you think that this could be contributing to? I think that if anything, straining because of the constipation and straining or contracting with even GI pain can contribute to the umbilical hernia. But I don't think that an umbilical hernia is, I mean, sure, you always want to optimize mechanics, right? So it could be pressing on some and aggravating the gastric emptying. But I am thinking that there's a lot here to suggest that there's a lot more contributing than something like an external, basically, other side of the peritoneum, umbilical hernia. Okay, so I'm gonna go back to everybody's faces here, and then maybe if there are other questions, everybody can ask now, and hopefully, and if especially on that last one or any of the questions I answered directly, if you guys that submitted those questions are here on the call and you want to ask some more, fire away.
Okay, I have a question. Have you heard of Organic Olivia?
Organic Olivia.
Yeah, her products at all?
I'm sorry?
Have you heard of her products at all? It's a supplement. It's all like,
it's the liquid vitamins. Yes?
No.
Different supplements? No?
just
Okay.
different. Oh, no, yeah, you're right. She does have some liquid. Yes. But we're
Okay.
currently doing the ParaPro formula. And I wrote the question about my son with the dairy and that stuff. But I know that you said the garlic and olive leaf, and that is the top 2 ingredients in the gut support encapsulation.
Okay.
So would I maybe do this instead of the biocidin? For
Well,
the
I think it would be one or the other, or to switch off.
I
As
think we're doing too much. Okay.
as opposed to duplicating anything.
Yeah. Okay.
But sometimes that can also, it can be a bit much. If any of you have ever taken, even especially an oil of oregano capsule, you can get a burp up of that, and it can cause a little bit of irritation, just like taking liquid oil of oregano. That can be intense going down. I always recommend to kind of take everything that you're giving your kids, even though it's not the same body, you will have some sense of what you're experiencing with it and what they might be. I see questions popping up in the chat.
Yes, Jerry, I think there's, do you suggest any healthy grain-free breads?
Oh, I'm sorry. I thought I had answered
that.
that.
Oh, did you? I missed that. Sorry.
Okay.
Next one.
Let's see. Pure encapsulations, gluten dairy digest before eating any dairy. I don't think it's pointless. No, that works on the that's not like a lactate. That works on the protein component, to my knowledge, on that pure encapsulations product. Yeah. It might actually be comprehensive. It might have some lactase in there, as well as some lipase, but then it's got the proteases for gluten and dairy. And I think more specifically, I think it might have the dipeptidyl peptidase, DPP4, to help break down gluten and dairy. Any suggestions for gut health as we go into flu vaccine season? All of it. Everything that I was talking about to help take the load off the gut, which is the seat of the immune system. As I mentioned also in our past gatherings, again, vitamin D level and zinc, right? Those are 2 nutrients that are vital to the immune system, because what they do is help to maintain the tight junctions of the cells of the small intestine to prevent permeability and inflammation and leaky gut. So we want to really keep the gut integrity intact and have a good, strong gut barrier. So, again, I'm not making dosage recommendations here because that can be very individualized and it depends on what someone's getting dietarily or environmental exposure, what maybe blood levels are. But certainly zinc, vitamin D, I mean, flu and even, COVID related, and vitamin C, those certainly come up and that's suggested in the literature. Antioxidants in general, so your plant-based vegetables, certainly also to keep oxidative stress balanced out and in check. And and I do think certainly some probiotic rich foods, if not just probiotics, can be helpful and beneficial as well. So that's where I would say, I mean, it's gut and immune support, but keeping the load down on the gut as well and keeping the sugars down, because as I said before, sugars create a lot of acid in the body as they're metabolized, and a more acidic body is more susceptible to germ proliferation. That's why you hear so much emphasis on alkalization and drinking green juices and green smoothies to alkalize, right? So, and of course, the more acidic the body is, as I said, it's going to look to try to neutralize the blood by pulling the calcium as a buffer into the bloodstream. And then that interrupts gut integrity, bone integrity when you're trying to grow and get the best bone density going on during this time. And calcium absorption may be being compromised as well if there's malabsorption and leaky gut going on. Because minerals get a tough hand. That also the iron that I talked about too. And by the way, if you're supplementing your kids with calcium and iron, they compete for absorption because the gut, even when it's in good shape, has to balance everything out. So you can give your iron in the morning. Vitamin C or an acid environment helps to absorb that. And another thing that PPIs run interference with is iron absorption. So the vitamin C and iron in the morning, and the calcium maybe with magnesium at later in the day, in the afternoon or evening or bedtime. So that's just in terms of optimization for absorption when we're already challenged with absorption. So we might as well be giving it at times where we can optimize absorption. So a lot to keep track of, guys. You're all doing amazing. And all right, let's see, what do we have? Technical issues. Just wanted to let you know that the reflux came after the constipation. Yes, sure. Yeah, that would make sense, right? Because we talk about when there's constipation, there's that equal and opposite pressure. So the chronic constipation, and then maybe the small intestinal bacterial overgrowth, and then the gas is produced, and then the reflux, right? So Neocate Junior should be available in Canada because it's produced by Nutritional, which is a UK company. Kate Farms also, I think, is now available in Canada also. So if that's it, it's 12:31. Guys, I need a little turnover time before my 1 o'clock appointment coming up and maybe some sustenance for myself. But it's really an honor to be participating with all of you in this kind of open forum too. And hopefully it was helpful. And maybe it also pulled together a little bit the 4 previous webinars that we did together.
Yeah, thank you so much, Jerry, and thank you to